Establishing a single-payer system would be one way to achieve universal coverage, and Senator Sanders' Medicare for All bill lays down an important marker to help us reach that goal, says Senator Al Franken. California Senator Kamala Harris and Massachusetts Senator Elizabeth Warren have both said they'll co-sponsor the bill along with a total of 15 Democrats. But we are here today to take another step, said Senator Warren. We will not back down in our protection of the Affordable Care Act. We will defend it at every turn. But we will go further. We will go further, and we will say that in this country, everyone gets the right to basic health care. At the same time, Republicans are trying to up the risks for insurance companies that support the ACA, undermining their ability to profitably provide coverage in many states. Is a single-payer system the only answer? Is Trumpcare dead or just waiting for its chance? What are the real details and measures involved in healthcare in the United States and around the world? Please join Indivisible South Bay as we probe these and other questions as we try to ascertain the best way to provide for the health of all of us who live together in America.
Hello, and welcome to another in a series of panel discussions sponsored by Indivisible South Bay. These discussions are meant to explore the many ways in which we at Indivisible South Bay are coping with the results of the 2016 election. This time, we're going to address health care. Specifically, we'll explore the details of the ongoing struggle to protect and defend and improve the Affordable Care Act, the ACA, otherwise known as Obamacare. My name is Eitan Fenson. I've been a startup engineer, entrepreneur, and executive here in Silicon Valley for 30 years. During most of that time, I've also been a very strong activist for social justice. Next to me is Marty Crow-Lucal, a PhD academic who has applied her research and academic expertise to learning everything she can about the state of healthcare throughout the industrialized world. Next to Marty is Ann Heinlein, who has worked as a pediatric nurse for major hospitals for almost 30 years. None of the four of us has any professional political experience. We're all volunteers with a wide variety of expertise and backgrounds. This particular discussion will be broken into two parts. We'll start by setting the context, by explaining some of the more arcane details and definitions that will help us explore the critical issues whose resolution will affect the lives of virtually all Americans. We will then address two particularly important aspects of our current national healthcare situation. In part two of the discussion, we'll go more deeply into two more aspects and then close with a look to the future. As always, if this show makes you want to get out of your chair, join with your friends, and take action to make progressive change, then we will have accomplished something. Okay, let's start with answers to some simple questions. Anne, can you help us by telling us what's meant by health care, by health insurance, and what the distinctions and connections between them are? Also, can you tell us whether the ACA, where it fits in between the two?
Sure, Eitan. Healthcare is a maintenance and improvement of physical and mental health, especially through providing medical services by medical practitioners. And then health insurance is a system through which those practitioners and those medical systems and services get paid for. Most health insurances, many people will get it through their employer. Most health insurance you have to pay premiums, and some health care is delivered by the government, like Medicare, Medicaid, and such. The ACA is the Patient Protection and Affordable Care Act, and that is a law that makes health care more affordable to people of certain incomes or who can't get health insurance through the usual channels, which we'll discuss, pre-existing conditions and everything later. It also gives some consumers subsidies so they can afford to pay for those premiums, and these are people with lower incomes. And then it also helps through the Medicaid expansion program, so more adults can qualify for Medicaid and get their health care that way. So health care is accessing the system so you can get prevention and health services, where health insurance is the method to pay for those.
Thanks, Ann. Now, going further, Marty, can you describe what's meant by single payer? And further, what do people mean when they say that other countries provide better health care than the United States?
Single-payer national health insurance is a system in which a single public or quasi-public agency organizes health care financing, but the delivery of care remains largely in private hands. So again, it's kind of like insurance, but the delivery of care is private. Mm-hmm. Now, why do people say other countries have better health care than we do? What do they mean by that? The U.S. is the only high-income first world country that lacks universal health insurance coverage. It spends far more on health care than other high-income countries, 17% of the gross domestic product. New Zealand, for example, which has better outcomes, spends 9% of its gross domestic product on health care. While we pay far more than other countries, our life expectancy is lower, our obesity rate is higher, our infant mortality rate is higher, and in Texas, it's equal to that of many third world countries. So what's the problem here? It has got better with the ACA. There's a lot of data points over the last four or 5 years, but let's cut to the chase. Health care outcomes for almost everyone are better. Gains in health coverage and access to care for low-income adults are particularly striking in states that expanded their Medicaid programs under the ACA to include more poor people. And this is from an article in JAMA, the Journal of the American Medical Association. The further behind people were, like in Kentucky, for example, Kentucky took advantage of the expansion of Medicaid, and the gains have been substantial. Texas did not, and it's worse. There have been many other studies, but there was one that was done by a group of clinicians from the Harvard School of Public Health. This is 500,000 adults age 18 to 64. And all of the measures that they looked at improved significantly with the ACA after the plans went on sale with the government-run exchanges. No question about it. We still haven't caught up with the rest of the world, but the ACA has made it better.
Thanks, Marty. For a long time, health insurance in this country has been inextricably associated with employment. It's worth understanding the history of this phenomenon and its ramifications in today's world. Historically, certainly when we were kids, the post-war period, employment was pretty much a lifetime contract between employee and employer. And the notion that an employer benefit would include health insurance was consistent with somebody being covered for the rest of their life. That's no longer true, and it hasn't been true for a while. And I think we're seeing a significant change in the dynamic. In particular, it has caused individuals to lose a lot of the security that they've had over the years. The ACA has loosened, but not eliminated, the tight bond between employment and health insurance. And can you give us a couple of anecdotal examples of how continuing this bond will perpetuate anxiety, misery, and financial ruin for large classes of Americans?
Yes. Even though you have employer-based health care, you still can have outrageously high premiums, basically, and then there's the deductibles on top of that. So even though you're working, you may not access health care because your deductibles are so high, things are out of your system, so you can't go see the specialists that you need to see. The other thing is, if you lose your job, you have no health care. And in trying to get more health care, if you have a pre-existing condition, you can be denied. If you want to strike out and start your own business or something like that, you may not qualify for health care.
But in the case of the ACA, those things have been addressed to a large extent.
Now that we have the ACA, you can get health care through the ACA. And I know some people who've gone on disability and got health insurance and got the health care they needed by utilizing the ACA.
I know that you've mentioned in the past that even with that, there still is some uncertainty in terms of what the plan covers. It isn't clear for people that they know what this particular plan that they get from their employers covers. There's also the question of deductibles. For many people, high deductibles mean that they have catastrophic health insurance, but it also means that they can't afford to go to the doctor anyway. It's very interesting. But now it's time to explore the issues at hand. Marty, can you expand on the answer that you just gave to give us some statistics that indicate how the ACA has changed the lives of ordinary Americans?
The number of people insured, for example, it's estimated that 19.2 million non-elderly people gained health insurance coverage between 2010 and 2015. Coverage, of course, means being able to get medical care when you need it, depending, of course, on the coverage that you have. This, in turn, means being able to be healthier, have conditions like heart disease and diabetes caught before the person ends up in the emergency room. We'll talk a little bit about Hawaii later, but there was a wonderful quote by the former director of Hawaii's health department and the former head of the American College of Cardiology. He said, "We learned a long time ago that when you give someone access to medical care, they get healthier."
It's amazing.
Truly. And he said, someday maybe the rest of the country will learn that.
And with your experience in the thick of our healthcare system, can you describe some particular patient stories that humanize the statistics that Marty has talked about?
Yes. I have a couple friends that, one who was laid off from her job, and she had a pre-existing condition. She was a cancer survivor. So when she needed health care, she wasn't able to attain it until the ACA passed. And then she now can get health care through the ACA. And fortunately, she actually tripped and broke her leg a few months ago, and she was able to have that taken care of without the huge financial burden it would have been if she had to pay for an ER visit and all of that on her own. Another friend of mine who went on disability, she could no longer walk because she had bad knee problems. She was able to have surgery on both her knees thanks to the ACA. She's getting her diabetes under control, and when all is said and done, she hopes she can rejoin the workforce. But she never would have been able to do that without getting the health care she needed through the ACA.
I'm shocked to hear all this. Anyhow, so it's clear that the message, the ACA is a totally failed program, is at best inaccurate, and at worst a fabrication promoted for cynical political purposes. When the Obama administration first chose to pursue broad health care reform, there were specific political considerations taken into account to make the ultimate bill palatable to more conservative sensibilities, and to avoid the promotion of the message that I just described. Well, alas, this was to little avail. But it's worth knowing some of these considerations. Marty, can you give us some specifics?
The original design of the ACA, and this is a surprise to many, came from the Heritage Foundation, a conservative foundation, back in the 1990s. It was an attempt to block what then First Lady Hillary Clinton was proposing, which was basically health care for all. And the Heritage Foundation published a document that said, no, what we should have is an individual mandate. It was seen then as a conservative alternative to approaches favored by liberals. Later, of course, most of the people who had supported it said, no, we never wanted it. But this was indeed the case. In 2006, the Commonwealth of Massachusetts passed a health care reform law with the aim of providing health insurance to nearly all its residents. The law mandated that nearly every resident of Massachusetts obtain a minimal level of insurance coverage. It provided free health care insurance for residents earning less than 150% of the federal poverty level. And it mandated employers with more than 10 full-time employees to provide health care insurance. It included the famous individual mandate, which requires most individuals to purchase health insurance coverage or to pay a penalty. This, of course, was looked at by Obama as a way to reach across the aisle, to get Republicans to agree to a health insurance coverage law. Well.
Yeah, we see where that led. I'd like to expand this analysis a little bit more beyond the medical and into something a little bit broader, particularly when looking at insurance in general. And when I asked you to define what health insurance is, you accurately pointed out that it is insurance for medical expenses. Well, insurance in its definition is risk management. What it is designed to do for people who purchase insurance is to spread the risk of issue of how much you pay for things over a large population and then over your lifetime, individual lifetimes. One example that most of us know, when you register your car, the state requires you to get auto insurance. It's an individual mandate. Why is that? The reason is that unless that risk is spread over a large enough population, then the insurance collapses. It is no longer able to cover the statistical expenses across a population. So Obama's correct analysis and correct, we'll say, adopting the conservative principles of spreading risk to an individual mandate certainly made sense from an actuarial standpoint. It is quite telling that that now has become a bone of contention, particularly with our fearless Speaker of the House, who talks about people having a choice rather than being forced to pay for health insurance. There is the notion, as we've discussed this before, and maybe you can describe what the notion of herd immunity is.
Herd immunity is usually used in the context of vaccines, so that if you vaccinate a large number of people, there's a certain percentage that are relatively safe from getting the disease because so many people are immunized. I believe it's like 98% vaccination, then that 2% have herd immunity. And some people can't be vaccinated because they're immunocompromised. Maybe they're getting chemotherapy. Maybe they've had a heart transplant. Maybe they have a genetic immunocompromised disease. But once you start lowering that, as we know, there's some places and counties, even in California, that are less than 50%. So that means if that disease is brought into the population, it can spread very quickly.
So it's appropriate that that medical paradigm be inferred or applied to the situation of health insurance. And I think the point there is that you don't need to have everybody insured. You don't need 100% insurance in order to spread the risk enough so that the people who don't have health insurance are covered anyway, or immune anyway. The bottom line is that the individual mandate will never be 100%, but the closer it is to 100%, once it reaches its critical number, then the entire society benefits. There's also the question of a moral hazard. That is an economic idea where if you provide something that most people have to pay for and some people can get for free, the people who pay for it will figure out a way to get it for free. And so it's extremely important to make sure that if you don't have an individual mandate, then what will happen is people will say, I'm healthy, I don't need health insurance. And then something happens, ooh, I better go get health insurance. That is a way to ensure that the risk management isn't spread over a large enough population. So indeed, it is extremely important that, that we have an individual mandate and that that risk is spread across the entire population. There's also the notion of pre-existing conditions. Before the ACA, it was virtually impossible, as you pointed out, Anne, that some people could not get insurance at all because they had a pre-existing condition.
And may I point out
Yes.
that as one gets older, it is extremely difficult not to have a pre-existing condition. In my tables, there was actually 2 countries where people did not have two pre-existing conditions. One was Japan and one was Denmark. Everybody else, age 65 and over, had pre-existing conditions.
I think, too, people don't realize that children also, if we allow the pre-existing condition to be a way to deny health care, children who were ever diagnosed with asthma, children ever diagnosed with leukemia or any kind of cancer, children with type 1 diabetes that they get at a young age. I mean, there are so many kids out there that once they're off their parents' health insurance at 26 would never be able to get health insurance, because it's not only old people. They can deny you pretty much if you've ever been to the doctor and they tick some box of some condition that you have, you can be.
And what we're
denied.
seeing is that the inability of the Republicans to get rid of the ACA is in large measure has been affected by this pre-existing condition. They're tying themselves in knots, trying to figure out how to sell the American people that they will maintain pre-existing condition ability to get health insurance, when in reality it's not. There's another, I know, Anne, there's a little anecdote that you have that is particular to gender-related health care, that a particular choice that you made at birth. What is that choice?
Being born with a uterus, because back before you could stay on your parents' health care until you're 26, when I graduated from college at 23, I no longer had health insurance, and I was going into the Peace Corps a few months later, and I would be covered by the U.S. government. But there was a few months I would not be covered, so Peace Corps sent me a health care policy, a health insurance policy that was relatively inexpensive, that I could sign up for to cover those few months. And when I looked at it, it covered me fully. The only exception was it would not cover my uterus. So I guess for 50% of the world's population, they weren't going to cover the uterus. But this was back before the internet, so I couldn't go on the internet and find different policies. So I figured, well, probably nothing's going to happen to my uterus in the next few months. So I took the policy. But it boggled my mind that insurance companies can pick certain body parts of yours of which you have no say whether or not you contain them or have them, that they can exclude those. But that's what health insurance companies can do. They can exclude anything they want to.
This concludes part one of our discussion, in which we have given specifics about concepts, talked about the effects over the past 7 years of the ACA, and about the considerations that went into the writing of the ACA. Thanks to you, Marty and Anne, for your insights and explanations, and thank you all for watching. Please join us next time for part 2 of this discussion.